My name is Dennis Gill with the Americans in Wartime Museum. Today's date is 11 December 2023. I am in Virginia conducting an interview virtually with Elaine Niggemann. Thank you, Elaine. Appreciate you sitting down and taking some time out of your day.
You're welcome. I'm happy to be here.
Great. If you could just tell us a little bit about who you are. Where were you born, grow up, go to school, that kind of thing.
Sure. My name is Elaine Niggemann. I was born in Spencer, Iowa, a farming community in northwestern Iowa, and my parents moved to Arizona when I was just 10 years old. So I pretty much grew up here in Arizona, grade school, high school. I went to ASU College of Nursing and finished that in 1970.
Okay.
And it was during that time I joined on one of the student nurse programs, my final semester of my senior year.
Okay. So you were in the Army Nurse Corps?
Yes, I served a total of 5 years. After Vietnam, I got out, but I went back in a second time.
I understand. Okay. What made you decide to become a nurse?
Oh, it was, I think it was one of the opportunities available to most women. Those were still the days of secretary, teacher, or nurse.
Okay.
Besides that, I had an older sister who was in nursing, and she was a great role model for me, and I liked it. I thought I would like it.
Okay. Okay. And what made you join the Army?
A couple of different things. One is that I had been in the Phoenix area for since I was 10 years old, which really at that point was only about 10 years, but I wanted to get out and about. And the
Okay.
Army Nurse Corps was an opportunity to do that. I joined with my best friend. And one other thing is that during that time, so we became interested in, I guess I'd have to say 1969. And in those years, we were watching TV and seeing a lot of newsreels and the Bob Hope show. And I wanted to serve. I wanted to go over there. It was naively, I thought of it as an adventure. And in many ways it was,
Right.
and I wanted to serve and go to Vietnam. And the Army gave me the best opportunity to do that. I looked into other services as well, but again, the Army, I thought, gave me the best opportunity to do that at that point.
Okay. Any other family members that were military?
No,
So you're the
my
first.
dad, my dad had gone down to enlist in the Army during World War II, but was actually denied because of some physical problems.
Okay. Okay. What year did you go to Vietnam?
I went to Vietnam in 1971, early 71, came home early 72.
And what does the Army do to prepare you to go over there?
Well, first of all, we had basic training. That was a 6 week course at Fort Sam Houston in San Antonio. And because I was just out of nursing school or had just finished my degree in nursing, I think almost everybody was still given an opportunity to have some clinical experience before we went directly to Vietnam.
Mhm.
So I spent 6 months at Fort Sam Houston at Brooke Army Medical Center, and then I went to Vietnam.
Okay. Okay. Did the Army did they tell you what to expect when you got there?
Oh,
What kind of things you would see? Because I know a lot of what you would have done would have been traumatic because you're working with soldiers who have been injured, many of them severely. Did they kind of warn you about what was going to happen?
well, I think honestly, I'm not sure there is an adequate warning. A lot of what anyone experienced, in my opinion, what anyone experienced in Vietnam was dependent on when they were there and where they were, and even what ward they were on. A lot of factors went into the experience any person had, as well as a person's underlying personality and how they perceive things or dealt with stress. But in our basic training, a lot of it was becoming acquainted with the Army in and of itself. Who do
Right.
you salute? How do you put on your brass? what outranks what. And part of that, though, we also learned a lot about Vietnam, anticipating that most of us were going to go. So we had 4 days in the field, they called it, at a camp at what was Camp Bullis, and we went out in buses every day and learned how to set up a tent hospital, triage patients. We did the gas mask experience with the tear gas, and we also had an opportunity at that time to shoot a gun, not not very not very long, but a couple of bullets. I think some people hadn't had an opportunity to ever do that, so it was
Right.
good to know where the trigger is and how to handle it. Even should a weapon become misplaced and fall on the floor in the hospital, so how to pick it up, that kind of thing.
Okay. Okay. What are your initial experience or initial thoughts when you get to Vietnam? What's the first thing that runs through your mind?
Well, I think it was very exciting. We arrived at night, and it was as we stepped off. Even when they opened the door to the plane, and this was, of course, before they had jetways, and we had to go downstairs and walk across the tarmac. Even when they opened the door, it was hot and humid, and a man came on board and said what to do should we have any incoming while we are deplaning, and to keep your head down and keep walking. And from there, we got on buses that were led by a Jeep with a machine gun on it and drove. We only had 5 or 6 miles to go, I think, to Benoit, where we stayed overnight we had beds with mosquito nets. And then the next day, we went to the USRV headquarters to get our hospital assignment.
Okay. Were you in a dorm or did you have a room with a roommate?
We had a room, and there were three of us there. I can't remember how many beds, if there were 3 or 4 beds, but there were just three of us women on the flight.
Okay.
And then we all ended up at the what they called the 90th replacement. One vivid memory is that I tried to take a shower in their showers that they had available for the women. And
Okay.
gosh, when I went back there and turned on the water, it was brown. And I thought, oh my, I don't know if I can do this. I had those thoughts a couple of different times in the early weeks, but it was brown. And then what's I think funny for me is that when I came back a year later through the same 90th replacement, it was still brown, but it didn't bother me anymore. So I had adapted.
Right. So do you did two tours in Vietnam?
No, I just did one.
Just did the one. Okay. Gotcha.
I was ready to
Anybody?
come home. We'll get to that maybe, but I was ready to come home.
Right. I'm sure. Anybody give you any advice? Any family members advice? Your parents? I'm sure they were a little apprehensive, right, that you're going into a war zone.
Well, my advice actually came from a wonderful nurse that took me under her wing in my first 6 month assignment. And she had just come back from Vietnam. And I was, of course, anxious to go. And she helped me on the wards, learning to do certain things that she knew I would be called upon to do in Vietnam, and also gave me a lot of tips about how to conduct myself and being careful about certain things. So I had great advice from that person who I am still in touch with.
Okay. Very good. What is a typical day like?
At my hospital, the 24th evac in Long Bin, we had 12-hour shifts. And again, my experience was based on where I was assigned. And I was assigned to a surgical unit. We got patients after they came out of the operating room. And we had a kind of a three different areas within our 60 beds. And part of it was the intensive care unit, along with a burn unit. And a second part was the intermediate care. And then a third part was minimal care, which included patients that if we were in the United States, they would have gone home. But because they had wounds that needed some dressing changes, or something that still needed a little bit of care that they couldn't get in the field, they were kept on that area. So it was a post-op surgical unit. And the typical day was starting at 7 o'clock, and we would get report and hear about any new patients that came in during the night or any events that in particular. We went through every patient and heard about what was needed for our coming shift. And then we would do it. We would pass medications, we would start IVs or restart IVs. There were a lot of dressing changes because it was a surgical area. And the day usually went very fast.
Okay. What is it? What's your work schedule like? Are you working 6 days a week, 7 days a week?
When
What kind
I,
of schedule?
not seven, when I first arrived, it was 6 days a week. And then
Okay.
about halfway through, things were slowing down. Again, I was toward the end, and we got an extra half day. So it was 5.5 days a week. And many of us, depending on the half day that we had available, we would go on a MedCap, the Medical Civil Action Program. And so that was a really nice thing to get out. And we ended up going to usually to a Catholic orphanage, and found that eye opening, having grown up in a city area. It was very eye opening.
Right. In what way?
Oh, just what we have here and what they didn't have.
Yeah.
At the orphanage, they had cribs with wire on the bottom. It was a fine mesh wire, but it was a wire was the bottom, and they usually had a thin mattress, but not always. And then inside the small cribs, not what we would call a standard size crib in the United States, there would be three babies all in one crib. Uh, that kind of thing. I never had seen anything like that. I went to a Vietnamese Army hospital one day, and it was a 3,000 bed hospital with 6,000 patients. And the reason they could accommodate 6,000 is because they would have two or three people in one bed, or they would have uh, stretchers sticking out the windows to make room for people to sleep. So it was very eye opening.
Right. Right. Do you have any downtime while you're there? Recreation, anything like that?
Oh, yes. Um, we sure did. We had some downtime. We had a scheduled day or day and a half off. And usually at the time I was there, we were able to have that day off. Sometimes
Mhm.
I would try to go somewhere. We could sometimes try to arrange would be like an overnight trip to another army base, army post, and sometimes it was just catching up on things, writing letters home or visiting with friends, or there was time. And we also, of course, had R&R, which was wonderful. And the way our schedule worked, we were able to fit in a week or even two separate weeks of leave. So that gave us some nice travel opportunities and a good break from our usual work.
Right. Right. Where did you travel?
My R&R was to Sydney, Australia, and that was memorable. And I also took a week going to Hong Kong, and that was a wonderful shopping trip. And the other week I had was going to Thailand, and that was so nice to. It was so nice to go to other cultures and widen horizons. It was certainly one of the things I had been looking for when I wanted to join the army, and got was able to get in some good travel.
Right. How about keeping in touch with family? Were you able to make phone calls, or was just letters?
It was mostly letters and tapes. The only phone calls were at that point what we called Mars calls through a ham radio operator, and I think I had two of those in the year that I was there. And of course, I wrote a lot of letters. And then this was a time when audio recordings on tape recorders were popular.
Hmm.
So I could record on my tape recorder, send the tape home, and then my family would record back to me. So that was nice to hear their voices. It was always great to get mail. That was a highlight of every day if you got mail.
Right. Right. Uh, what are there any moments that stand out, memorable, good or bad? That stuff that you, when you look back on your time, always seems to be something you remember.
Oh, yes. There were some special patients. I think most of the ones that I still remember are the patients that died. And that
Hmm.
was hard. It was very hard. I think had I been a parent at that point, I couldn't have done it. But fortunately, I was young and I want to find a word other than naive, but young, and I just didn't comprehend the terrible loss as a parent
Right.
that would have been felt at home. So, I remember some patients that, we would try very hard to save. I remember sitting with patients that we knew were not going to make it because they had perhaps severe injuries to their head. And we would just sit with them and talk to them and keep them comfortable, but we didn't want them to be alone. So that was always a very hard but very meaningful to know that they didn't die alone. And then there were some good ones too. There were some good ones. I remember when I was walking out to go back to my hooch to go on my leave to Australia the next day. As I was leaving, one of the patients who had had a tracheotomy for a week or two in the ICU and been on a ventilator was getting better, and he was able to plug up his trach and say goodbye and thank you. And it was very raspy, but it was very meaningful because he had been so sick and he pulled through, and it was great for him to say thank you.
Right. Right. How did you find the Vietnamese people that you interacted with?
Very
Do they see
nice.
you in a positive light?
They were very nice.
Yeah.
We had some Vietnamese people working on our ward, especially there were a couple of nurses, what we would call nurses aides, and they were great. Their English was good enough. I took a Vietnamese medical language course when I was there. It was again dependent on my work schedule, but it was close by, and I was able to learn a few words, but nothing that would make me conversant. But these the aides were quite good, and so nice. And working with them every day, they were able to share some of their stories about their families and what had happened and how they ended up working at our hospital. So I found them very nice, and I think those were mostly the only Vietnamese people I interacted with much at that time. Our patients, some we would get some Vietnamese patients, especially if I remember, especially a few children, and then we would let a parent stay with them.
Hmm.
So if they could communicate in English, we were able to get to know them a bit. So that was good. I think in the outside of our army post, though, I don't recall really knowing any of the Vietnamese folks.
Right. Right. What about some of the good things? Some of the
Oh, I'm
positive.
glad you asked me. I'm glad you asked. Um, it wasn't all bad. Certainly, there were some very challenging days, and I cried, and it was very hard. And so, some of the good things were first professionally, the the things that we did in nursing were much more than what I would have been able to do as a civilian nurse in the United States. And it really I felt like it enabled me to have a real sense of value that I was needed there. If the whole medical team, medics on the field, the helicopter pilots, corpsmen, doctors, nurses, everybody, it was a huge team effort to get our patients back home. And part of being a team and the things that we did really gave me a great deal of confidence that I was able to take with me when I returned. Another thing was just the personal growth. Traveling. to different places, and also the opportunity to go away from home for a bit and know that I could get along, although certainly had a lot of people there helping me. It wasn't like I was out in a foreign country all by myself. So, but it was a great opportunity for some both personal and professional growth. There were times later on in some of my schooling that came that were very hard, and I would use Vietnam as a yardstick. I would say, "Gosh, if I can get through Vietnam, I can do this." So it was a good for my confidence. Other positive things were the relationships we had with the people that we worked with. Since we didn't have our family there and we were with these people, working with them or seeing them after work hours, you just get to know people and count on them. And the relationships, I think, were really helpful to get through some of those harder times. And I mentioned being in some areas where I recognize that they didn't have nearly what we have in the United States. And it gave me a great sense of appreciation for what we have. We were about, I think, 25, 30 miles from Saigon. And so it was easier to get a helicopter ride in than going in an automobile. But the times that I did go in an automobile and we would drive on that highway, you would see guards in there with their sandbags and their machine guns and the concertina wire just there on the streets in Saigon and on the highway. We would hopefully never see that in the United States. And so I developed a great sense of appreciation for our freedom and our relative safety. So it was good. It was a very growth producing year. I'd say my most growth producing year.
Right, right. Tell us about your homecoming.
Mine was good. I, in retrospect, feel like I must have been a pretty naive. Now I can really say naive and mean it. I was a very naive person and a trusting, and my focus was going over there to take care of our guys. I
Right,
was not as involved in the politics, and I just wanted to go over there and take care of our guys. And when I came home, I uh, went from Travis Air Force Base to Sky Harbor Airport, and my family was there to meet me. I was in uniform, but nobody spit at me or threw eggs or rocks. My family was there and greeted me so warmly, and it was so wonderful to be home. And it didn't take but a couple of weeks that I wanted to start back to work. And I worked at the hospital that was nearby where I'd actually been a candy striper and a nurse's aide, and then I went back as an RN. And that was good. And in fact, I even think the fact that I was a Vietnam veteran gave me a little bit more credibility as I worked in the different areas. So that was mostly good. Again, there was a major transition going from an army nurse to a civilian nurse, and I'll share that it didn't wasn't was not a good fit at that point. And I waited about 1 month or 6 weeks, and I thought, well, this isn't going to work in a civilian hospital. And that's when I went back in the army on another student program. So that was the biggest thing for me, was just transitioning back to civilian setting and civilian hospital.
right, right. How do you think your time in Vietnam would shape who you would become?
Well, how do I think it would have shaped or did shape or?
How did it shape? How did it affect who you became in later
Oh,
years?
it's huge, huge. When I joined the army, as a senior in college, um, it was I thought I was going to sign up for an adventure. And little did I know how much being in the military, and I think this is probably true for everybody who joins the military. You maybe go in fairly naively, like I did, and then it's with you for the rest of your life. I mean, I'm always a veteran. I'm always a Vietnam veteran, and I actually didn't get involved with veterans or any of the veteran activities until just a few years ago. I think I was busy with school and work and family, so I didn't get involved until just a few years ago, and had an opportunity to be with a group of veterans, and thought, oh my gosh, this is wonderful. This is so nice. And I heard their stories that I had never heard when I was taking care of patients. I don't think I ever took time to ask, or maybe they weren't ready to share, or I wasn't ready to listen, but I never heard their stories like I did 50 years later.
Hmm.
It really made me have so much more empathy. Maybe I'm not sure I would have been able to do my job had I known what they came from.
Yeah.
So,
Yeah.
so
Were you
it's been a tremendous, it was a tremendous, and it is a tremendous part of my life.
right? Right. Was there ever a time where you weren't able to talk about your experiences? That you didn't want to relive them, or did you not experience that?
No, I don't think so. Not really. There are times, sometimes, I'll be saying something about it, and then I get kind of choked up, and it's hard to talk about it. But I don't know. I think I was just so busy with other things that I had to just move on mentally.
How if somebody watches this years down the road, what would you like them to know about your service?
Oh, that's a great question. What would I like them to know about my service? That I am very proud to have had the opportunity to serve in the military. And I am very proud to have had an opportunity to take care of our soldiers. They were so great.
Yeah. Is there anything else you want to document? Anything I haven't asked you?
No, I think being in the military is a very good experience. I probably have to say that it's not for everybody, but it
Mhm.
sure was a positive experience for me. And it was a very positive experience for me.
Yeah. Well, Elaine, on behalf of the Americans in Wartime Experience, thank you very much for taking some time out of your day to share your story. I
Yes.
want to thank you for your service, and I want to welcome you home.
Thank you very much. Thank you for inviting me. You take care.